Hi, I'm Dr. Michael DiTolla, the Director of Clinical Affairs for Sirona Dental, and welcome you to the Sirona Media Panel. We're coming to you live from the 2016 Chicago Midwinter meeting. And today we've got a guest with us, Dr. Jeff Rohde from Dental Compare. Jeff, how are you doing today?
Hi, doing great,
Good. Well, on your left, with Dr. Clark Brown from Melbourne, Florida, one of the
Brown?
beta testers for our Sarek zirconia product. And to his left, Roddy MacLeod,
Roddy, always good to see you,
of
Roddy.
CAD-CAM, resides in Germany and oversees a lot of the R&D that went into a product like this to make it all possible. I get the feeling that as the first dentist to sit up here besides our panel, that you're going to have an appreciation for this product and everything that goes into it. Like the magic of how you can mill a crown that big and put it in an oven for roughly 12 minutes and they come out with a crown that's 22% smaller and yet fits better than anything we've seen before.
And fits perfectly right at the go.
It fits pretty darn good, and if you look at the margins on there, we haven't been able to mill margins like that before. I mean, those are true kind of feather edge margins, and a lot of dentists prep them unintentionally on preps, and this material can kind of deal with that. So it's really been a big game changer for dentistry. But I know you've got some questions of your own you'd like to ask the panel. So.
Oh no, I mean this is the whole thing, right? This is sort of the holy grail that we've been waiting for, is chair-side zirconia. I mean, this is a big game changer, wouldn't you say, for dentists who are already using Sarek?
I would, and very few people knew that the holy grail was actually made out of zirconia. But now, as you say, here it is.
Made from zirconia. Yeah.
The search is over.
Yeah. So how is this changing the way you guys are seeing Sarek being utilized? I mean, the applications for this aren't just the single unit crown. I mean, we have implants and.
Yeah, I think, and Clark can speak to this as well. Is we're excited because, you know, the thing about dentistry, as you know, is not one material can do everything.
Right.
If it could, then things would be very, very simple indeed. But as you go to the posterior, strength becomes more of a concern than aesthetics. And the opposite is true as you go to the anterior. And unfortunately, there's no material available today that answers all of those needs. So where we've had lithium disilicate materials in the past, Emax, Celtra Duo, and so on, we've had feldspathic materials, Empress CAD, Vita Mark II, Sarek blocks, and so on, some composite blocks. We're able to reach a very good level of aesthetics with those materials, but unfortunately it doesn't answer all the strength needs. Full contour zirconia closes that loop, and I think now for a dentist who's been sitting on the sidelines with CAD-CAM, I think they like the idea of single visit dentistry, but maybe they didn't feel there was all the right spectrum of materials available to them, and so now we're very excited about that. The Holy Grail, as you mentioned, we're very happy to introduce this now and get that into the market.
Right, and that's the thing. I mean, you know, I know you and I have talked about this before. Is I still come across dentists who don't realize that even if you have a lab fabricated zirconia crown, that's still digital dentistry happening, right?
Right. Yeah. Back when I was at Glidewell, I mean, it was I don't know, 6-7 years ago, where 100% of the crowns were made by CAD-CAM, and we had 13 or 14 MCXLs. We were the first lab, I think, to really embrace the concept from Sirona about milling, you know, at the time, Emax restorations. And we loved it because when you're part of a big lab and there's 850 technicians, you know, you can get one that's got 2 weeks of experience or 20 years. And all the mills have the exact same amount of experience. They don't show up hungover because they went to a hockey game with their daughter the night before and stayed out a little too late. That's just a theoretical example.
Theoretical,
by the way. And you just saw a consistency that we never saw before. And now dentists are able to see that as well. And, you know, you can do 3-unit bridges with this chair side as well. That's 22 minutes in the oven to be able to get the, you know, some of the strongest restorations ever seen in dentistry, with the exception of cast gold. It's pretty amazing what's being able to be accomplished chairside today. And Clark, as one of the beta testers, I know you've seen some of this stuff too.
In fact, I've done probably about 4 fixed bridges, 2 of which were single visit. I'm looking at about 2.5 hours start to finish.
Right.
You know, and to do a fixed bridge in that amount of time in a single visit is unheard of.
Pretty unheard of. And it all speaks to the patient experience, right? I mean, you've been doing this for a while, so you actually know, like, hey, I need to have a great experience for patients when they walk in the door all the way to when they leave. And this speaks to that. And,
you know, I tell you, every week I'll have at least 1 or 2 patients that come to me from another dentist because they know I do it in a single visit. But time is a valuable commodity for patients as well as dentists. They don't want to have to come back a second time. You know, I mean, it costs them money. They got to take off work. And now to be able to give them this service with a material that is unsurpassed is phenomenal.
Your staff should wear T-shirts that say "I do it in a single visit." when you said they come to you, I don't know. There's something probably a little catchier than that we can work on. A promotional campaign about, but it's true, being able to get it done in one appointment. And I don't know if you saw, but 1-800-DENTIST and Sirona are now working together, and all of 1-800's ads from this point forward are Sarek based, and they're great because it's Fred Joyle stopping people on the street saying, "Do you want your dentistry done in one appointment or two?" And they're like, "What kind of trick question is this?"
Yeah, I've seen
sorry,
those
dentist.
videos,
I only want to see you once. I don't want to see you twice.
Yeah, that is an interesting thing. I mean, you've experienced. I mean, for all the patients that really love coming to my practice, they don't really love coming to my practice.
Right.
They want convenience. They want quality, but they don't want to sit in that chair any longer than they have to.
Right. So here's a couple of interesting statistics that we collected recently, because leading up to this market launch, we knew that ultimately it still comes down to does single visit dentistry make a difference for the patient? So we went out and we did a survey of 700 patients and asked them questions about single visit dentistry and so on, and we found a couple of interesting things. One was 2/3 of the patients said that they'd be willing to drive further to their dental office in order to get single visit dentistry. So we thought, okay, that's pretty nice. And then we said, okay, now that's one thing. But what about aesthetics? How important is aesthetics to patients when it comes to their dental work? And we asked them, we said, would you be willing to accept a lower level of aesthetics if you could get it in a single visit versus two? And 2/3 of the patients said, yeah, I would be totally interested in doing it in one. So there's this value that's being attached to single visit dentistry, which probably is not shared so much by the practitioner, because you anyway have many procedures that take more than one visit.
Right.
50% of the patients said that they'd be willing to pay more. And then 2/3 finally, the last number I'll give you is 2/3 of the patients said that they'd be willing to actually change their dentist in order to find a dentist who does single visit dentistry, to your point earlier.
Right.
So as patients become more educated and they understand what's available to them in the market, and of course the internet has changed that dynamic dramatically, that's part of the discussion now. And so we in the profession, we need to understand that dynamic that as it's happening, and make sure that we're covering those options for the patient inside the practice, so that they stay in and bring the value with them.
Yeah, I think dentists want to do it in a single. When did you graduate from dental school?
2000.
I knew you were way younger than me. I didn't know it was that far younger than me. That's really amazing. But when I got out in 88, 19, not 18. When I got out in 88, most of the endo we were doing was multiple visits. Especially if it was molar endo, it was 2, 3, or 4 appointments. And then with engine-driven NiTi files and better obturation methods, we're doing almost all endo now in a single visit. We like it better. The patients like it better. If we could do dentures in a single visit, or not do dentures at all, 0 visits, that would be even better.
0 visit denture.
But if research came out that said posterior, like class 2 posterior composites are better if you do them over 3 appointments, I think dentists would be like, all right, I'm willing to sacrifice some quality there, dude. But I don't want to do it in 3. So I think dentists inherently want to do it and get it done as fast as possible. I just think that for a while, when they couldn't do the most popular crown and the strongest crown that they were getting from their labs chairside, it was kind of a deal breaker. So that's a big part of the story too, is you can now make the strongest crown in dentistry chairside in the same amount of time to do another glass ceramic crown.
Exactly, and I use Sarek every day, and one of the things that I'll tell patients is it's just as amazing to me every time I do it. I mean, it's not like we've gotten better at it, and the learning curve has been achieved, and we know how to manipulate the software, and we get great results out of this stuff. But it's just, every time we're scanning and we're watching that OmniCam pop up, that streaming image, it's just as amazing.
It feels like a magic trick.
It's like a magic trick,
Right.
and not a patient gets out of the chair and goes like they're not impressed by it. It just doesn't happen. How do you feel about that?
Pretty much the same as you. And patients, I'll design right in front of the patient, and they absolutely love it. And one of the things I'll tell them to do is, like right when it's getting ready to design, I say, okay, get your cell phone out, because everybody has cell phones, right?
Yep.
Ready, videotape this, and then I'll hit go ahead to design. It does this little dance.
The tooth dance. Yep.
They love it. They'll post it on Facebook and tell their friends.
I've let a few patients design their own crowns. Not very good at it. It really does not turn out well. Occlusion's way off, contacts not even close.
Yeah.
Yeah, that's where I draw the line. I'll let them watch, but I won't let them actually design it.
One of the things we've heard over the years with respect to Sarek, because I agree, I think a lot of doctors see the benefit of single visit dentistry. They understand that their patients are going to love it, but they're reticent to jump in. And one of the things they've told us over the years is, hey, I don't want to be a lab technician. I'm trained as a dentist.
Right.
And so when we developed this furnace and this workflow, and you've had a chance to see it now, one of the things that we've done is that furnace is completely controlled by the software, meaning you can't actually program the furnace.
There's no controls on it.
There's no buttons.
There's not
no
even an
switches.
on-off switch that I can find.
The whole thing is controlled by the software because we know from the design of the restoration, the size of the restoration, the volume of the restoration, and also the shade. And we use those parameters to set the sintering and the glazing cycles so that there's actually nothing to do. And so the integration, we've been very careful to make it so that basically anybody can integrate this into their practice with very little training. Basically just interacting with that tablet, hitting play or selecting the job. That's it. There's no programming to do there. The speed glaze that we have, it's colorized, so you spray it on, but it has a color so you can see, have you covered the tooth completely, or are there places where you don't have enough color on and so on. And of course that all burns out during the glazing process, and all that's remaining is the glaze. But that color really guides the user so that the training becomes very fast. It becomes very simple.
And it's a great speed glaze too. I mean, the quality of the glaze with that speed glaze is better than any of the other glazes.
Well, again, it's the dentist not wanting to be the lab tech, so if they don't have to stain it, and they can just shake a can and spray it and cover it, or the assistant do it, that's one less step for them where they're not going to feel like they're being a lab tech and they're still going to be a dentist. Or even the shade guide, which is actually made from the zirconia material itself. So typically we're using denture teeth to take shades for ceramic materials, which really makes no sense, but the ability to actually use the material itself as the shade guide and do it helps get you a little bit closer as well, because it is a kind of material that because it's not as translucent, it doesn't tend to disappear as much, but we've kind of made a step in the right direction by giving a more accurate shade guide, so at least you can get a little bit closer. So really Sirona has, and Roddy was the driver behind a lot of this, tried to kind of dot every I, cross every T to make it simple, straightforward. I hope we have the opportunity to get some of this into your hands pretty quickly and let you try it on a few
I really
patients.
hope so too, actually.
Do you have some family members or staff members that you'd like to try your first one on? That seems to be the consensus of a lot of the beta testers, is they like to experiment on non-paying patients.
On families, yeah. Well, they're much more forgiving if it doesn't work, obviously.
Exactly.
But that's something that, you bring that up. When we say we're trying this out, really it's proven technology, it's proven materials, right? One of the things that I've heard over the years is it's kind of hurry up dentistry and the quality isn't there, but the reality is it's the software, it's the engineering behind all this, so we're really creating a more efficient product, right?
Sure. We've taken a lot of the knowledge that we've learned from our laboratory CAD/CAM business and actually transported that over to the dentist business. And historically we did it in reverse. We took a lot of the dentist technologies and put them into the laboratory. And there's a natural collaboration there. But so far as the sintering goes of zirconia, we learned a lot of that because we have that product on our lab side of our business, but also the material itself. So the Sarek zirconia is actually one-to-one the same material we've been using in the laboratory business for over 5 years. We've done millions of restorations with that. It's as reliable as can be. So it's on the level that you can say, hey, that technology is going to work. It's on a very good stability level and so on. So we feel confident now putting that into the hands of the dentist and the auxiliary staff that they have there, and being certain that they're going to come out with a very efficient result and a high quality crown at the end of the day.
Yeah, and it's not meant to replace any other of the materials. It's just now a part of the product line. Roddy said there's not one product that can do it all. I don't think there will ever be one product. I'm not sure that there's whether it's composites or whatever, where there's just one product that does everything for every indication. I don't think it's supposed to be like that. There should be a continuum of very strong materials that don't look as good, very weak materials that are just absolutely stunning when they're used as a veneer material. And the big part of the story is you can now do all those. You don't have to, make any compromise in your choice of material. And I don't know about you, Clark, but our other beta testers have been echoing my own sentiments, which is One of their favorite things about this is the ability to cement it and never have to bond these into place. And they're like, oh my God, I forgot how fun resin-modified glass ionomers were and easy they are to work with and clean up. Have you been reintroduced to the love of cementation?
And a huge time savings as well. I mean, it's bonding's a problem.
It's witchcraft. It's not just that we're lazy, Roddy. I know that's what we tend to say, just joking around. It's that there's witchcraft involved with etching dentin, with post-operative sensitivity and actually forming a hybrid layer and all this other stuff. And cementing's been around since the beginning of dentistry with zinc oxyphosphate, and we know cementing works, easy to clean up, not getting stuff stuck subgingival, all that good stuff. So.
Yeah, no, and that's the thing. Is the thing that I immediately recognize about it is it's just approachable technology.
Right.
It's actually, you say, oh, it's better for the patients, and your question was kind of leaning toward, hey, is it better for the doctor? I mean, I would agree. I mean, this makes my life easier if I could just cement something that's way easier than bonding.
Yeah.
Or not waiting for something from the lab. And
we jokingly call it a shade A2, cast gold in a sense, because it is that tenacious and that strong. And because you can cement it and it's that strong, it almost is a return to more classical dentistry. It's almost like an A2 version of a cast gold, which most of us as dentists love. Because you can make the margin so thin, and this has a lot of those properties. So it is almost a return to like classical dental technique in a sense, because we're not dealing with a finicky, weaker material that needs to be bonded into place.
Absolutely.
Well, Jeff, thanks so much, man, for coming up and joining us.
This is great.
Jeff,
love reading Dental Prepare.
Thank you, Jeff. Great to see you.
Thanks to our esteemed panel as well. Love having you guys up there. That about wraps it up for this media panel. I want to thank you for your time and your continued commitment to quality dentistry.